Hi YouTube, it's Sinead. In case you haven't figured out by looking at me, I have gone under the knife. I went yesterday for rhinoplasty, aka a nose job, which is where they change the aesthetics of your nose to make it look better. Yeah, sorry, I'm kind of talking quiet because my brother is upstairs sleeping. I'm actually staying at his house for the week until my splint is taken off next Tuesday. Instead of rambling, though, I'm going to just get right into why I decided to do this video and why I decided to go for the surgery. This actually wasn't something I was going to share with anybody, just my boyfriend and my mom and, my brother, because I was going to be staying here. But then I realized it wasn't anything to be ashamed of. Not a big deal. It's nothing to be embarrassed about. I just wanted to do this video to help you in case you are considering it. My reasons for doing it was just I never liked my nose. I always say that it looked like a witch nose, but not as drastic. So it came out, went down, and hooked. It's something that I've wanted to do for a couple years, and I've done a lot of research on it. I always wanted to do it since I was younger, since I was a little girl. I've never been happy with the way my nose looked, and then recently, and I'm not saying this to put anything on my sister, she's not a bad person, but in October she hit me in the face and my nose broke a little bit and shifted to this side. So that was another reason to hate it more. The only reason that I hadn't gone in the past was because I was scared of what people would think, and then I realized I really don't care. I went for a consultation in May, and I researched a lot of doctors, even outside of my area. It's actually about half an hour away from where my brother lives. And he has been specializing in rhinoplasty for 20-ish years. He specialized in people with cleft lips and palates, which are actually the hardest rhinoplasties to perform. I went to go to the consultation. He told me what he could do, what he couldn't do. He asked me if I wanted any tip work, and I said no. He said good, because I'm not touching the tip, there's nothing wrong with it. He just made me feel really comfortable, and he was the only doctor I went to go see, but I knew that it was a done deal. He was the perfect doctor to do it. So the night before my surgery, I had to fast after midnight. I wasn't allowed to have anything to eat or drink after midnight, and I wasn't able to smoke for 12 hours before my surgery, but I cheated just because I was nervous. I also wasn't able to take any multivitamins, have herbal tea, or take any Advil or aspirin for up to 2 weeks. I'm not really sure why, but that's what they told me to do. The day of the surgery, my brother drove me down. We got there about half an hour early, but they took me in right away down to the locker room, and they gave me a gown, a robe, a hairnet, booties, compression stockings just so no blood would pool in my calves during surgery, just in case. And then my brother came with me into the exam room, and we just waited. We spoke to the doctor, the nurse, and to sign some waivers just to say that I trust him to do the best job that he can, and if I don't like it, it's just because I'm picky. Because he's really good at what he does. They took some pictures of me for, I guess, before and after. We also spoke to the anesthesiologist. The doctor and the anesthesiologist just let me know everything that was going to be happening during the surgery to put my mind at ease, and just so that I knew what exactly would be happening to me. I gave my boyfriend a call before I went in because unfortunately he wasn't able to make the trip with me. I gave him a call and it just calmed me right down. So then I went into surgery and took me up to the IVs, and when they gave me the anesthesia, it actually felt really cool. It went right up my arm and it was really cold. And then I just felt it go all over my body and I just was out. And I woke up when they were wheeling me out to the recovery room, and I wasn't in any pain. I woke up, I had this splint over my nose. They iced my face and gave me some water. My nurse had to help me sit up because I couldn't lift myself up. felt really heavy. Oh, and before I went into surgery, they gave me some pills for nausea and pain. So that's probably why I wasn't feeling anything at the time. So in recovery, I was there for an hour. I just kind of rested, got myself back to normal, and my throat was so raw when I woke up. I put a breathing tube down my throat, and they said that they had to put something on my teeth so I wouldn't clench down and chip my teeth. Also, ointment put on my eyes, and I couldn't even open them. When I first came out, it was just a big blur. It kind of just felt like Vaseline on my eyeballs. The procedure was closed. It wasn't open, so there's no actual visible incisions. The incisions are actually are here, but further back, and so the sutures are just in this area. He gave me dissolvable sutures, which is good because then I don't have to go back and get them removed. They'll just come out on their own. They didn't have to break my nose because they only break the nose to make it narrower, but it was just the profile that I had a problem with. What I had to do was shave a little bit off and make it a little bit more slopey. I didn't get any packing in my nose. I didn't get a drip pad. They just said that my stitches might bleed a little bit, so just hold some tissue there for a few minutes until it stops. It was worse last night, the day of the surgery, and today it was just every couple hours I just have to do it, but last night it was every half an hour. It was just gushing. I haven't been in any pain. They gave me a pill with just 30 milligrams of Tylenol 30 and 30 milligrams of codeine, so I'm not in any pain whatsoever. I was a little bit last night because I actually forgotten. I took a pill once I got home, but I had forgotten to take my second one 6 hours later. In any serious pain, the only time I am is when I laugh really hard and my nose crinkles up. I woke up in the middle of the night in pain because when I was sleeping I smacked myself in the face by mistake. And the way I have to sleep actually is I have a bunch of pillows stacked up. So I'm just leaning back like this. And then I put some here, so it's kind of like I'm sleeping in a chair, but in a bed. My nose is ridiculously itchy underneath this metal splint, and it is probably worse than even being in pain because I can't do anything about it. I have to avoid bending over because the blood can actually rush to my head and make me dizzy, and I could faint, which would not be good. I actually forgot a few times today and completely last night, and I was petting my dog and it didn't go well. But yeah, I can't bend over for 2 weeks. I can't go back to work for 2 weeks, and even when I do, I can't lift anything over 10 pounds. I can't do anything strenuous for 4 weeks. So I don't know how that's going to happen because I am a waitress and sometimes I have to lift heavy shit. So the other thing is I cannot get my splint wet. I had to take a bath today, and I just took a cup and had to wet my hair like that and hold it. And it was really awkward. Just to wash my face, I just take a face cloth, wet it, wring it out, and just kind of dab my face. In order to take care of the stitches, all I have to do is I can take a wet Q-tip and just clean around, not in my nose, but around here if there's any dry blood, and I have to take polysporin and stick it up there when I wake up and before I go to bed. Didn't have any bruising yesterday. It's mostly just under my eyes and right in the corner here where all the bruising is, but I won't get any shiners, just slight bruising and swelling on the bridge of my nose and right here. Because it's only a minor rhinoplasty, I will be able to see the full results after 6 months because nothing was broken and it was closed. Most rhinoplasties, it takes about a year to a year and a half for the swelling to completely go down to see the final results. I actually have to go back tomorrow because the tape on my splint is not holding up. As you can see, it's not sticking to my face anymore, and I was texting with my doctor and he said the splint won't fall off. He's never seen that before, but if the splint does get loose, my nose will swell out and it will not heal properly. So I need to go back and get more tape on it tomorrow. I will keep you updated probably every day, every second day, just to see what's going on, and then, you know, hopefully I can show you the final results at the end of this week. So thank you for watching.